Fluoxetine is a selective serotonin reuptake inhibitor used to treat major depressive disorder, bulimia, OCD, premenstrual dysphoric disorder, panic disorder, and bipolar I. In this video, let's found. What is fluoxetine? What is fluoxetine used for? Contraindication. What are the side effects of taking fluoxetine? How does fluoxetine work? How to use fluoxetine? What is fluoxetine? Fluoxetine, sold under the brand name Prozac, among others, is an antidepressant of the selective serotonin reuptake inhibitor class. It is used for the treatment of major depressive disorder, obsessive, compulsive disorder, bulimia nervosa, panic disorder, and premenstrual dysphoric disorder. Fluoxetine was discovered by Eli Lilly and Company in 1972 and entered medical use in 1986. It is on the World Health Organization's list of essential medicines. In 2020, it was the 25th most commonly prescribed medication in the United States, with more than 3 million prescriptions. Lilly also markets fluoxetine in a fixed-dose combination with olanzapine as olanzapine/fluoxetine, Symbyax. What is fluoxetine used for? Fluoxetine is indicated for both acute and maintenance treatment of major depressive disorder, obsessive compulsive disorder, and bulimia nervosa. However, it is only indicated for acute treatment of panic disorder independent of whether agoraphobia is present. Fluoxetine may also be used in combination with olanzapine to treat depression related to bipolar I disorder and treatment-resistant depression. Fluoxetine is additionally indicated for the treatment of female patients with premenstrual dysphoric disorder, PMDD. Contraindication. Concomitant use in patients taking monoamine oxidase inhibitors, MAOIs, and pimozide is contraindicated. Also contraindicated in patients with a hypersensitivity to fluoxetine, hepatic or renal insufficiency. Side effects. Side effects observed in fluoxetine-treated persons in clinical trials with an incidence greater than 5% and at least twice as common in fluoxetine-treated persons compared to those who received a placebo pill include abnormal dreams, abnormal ejaculation, anorexia, anxiety, asthenia, diarrhea, dizziness, dry mouth, dyspepsia, fatigue, flu syndrome, impotence, insomnia, decreased libido, nausea, nervousness, pharyngitis, rash, sinusitis, somnolence, sweating, tremor, vasodilation, and yawning. Fluoxetine is considered the most stimulating of the SSRIs, that is, it is most prone to causing insomnia and agitation. It also appears to be the most prone of the SSRIs for producing dermatologic reactions, e.g. urticaria, hives, rash, itchiness, etc. Pharmacodynamic. Fluoxetine blocks the serotonin reuptake transporter in the presynaptic terminal, which ultimately results in sustained levels of 5-hydroxytryptamine, 5-HT, in certain brain areas. However, fluoxetine binds with relatively poor affinity to 5-HT, dopaminergic, adrenergic, cholinergic, muscarinic, and histamine receptors, which explains why it has a far more desirable adverse effect profile compared to earlier developed classes of antidepressants such as tricyclic antidepressants. Mechanism of action. The monoaminergic hypothesis of depression emerged in 1965 and linked depression with dysfunction of neurotransmitters such as noradrenaline and serotonin. Indeed, low levels of serotonin have been observed in the cerebrospinal fluid of patients diagnosed with depression. As a result of this hypothesis, drugs that modulate levels of serotonin, such as fluoxetine, were developed. Fluoxetine is a selective serotonin reuptake inhibitor, SSRI, and as the name suggests, it exerts its therapeutic effect by inhibiting the presynaptic reuptake of the neurotransmitter serotonin. Result, levels of 5-hydroxytryptamine, 5-HT, are increased in various parts of the brain. Further, fluoxetine has high affinity for 5-HT transporters, weak affinity for noradrenaline transporters, and no affinity for dopamine transporters, indicating that it is 5-HT selective. Fluoxetine interacts to a degree with the 5-HT2C receptor, and it has been suggested that through this mechanism, it is able to increase noradrenaline and dopamine levels in the prefrontal cortex. Halflife. The half-life of fluoxetine is significant, with the elimination half-life of the parent drug averaging 1 to 3 days after acute administration, and 4 to 6 days after chronic administration. Further, the elimination half-life of its active metabolite, norfluoxetine, ranges from 4 to 16 days after both acute and chronic administration. Dose. Major depressive disorder. Indicated for acute and maintenance treatment of major depressive disorder, MDD. Initial, 20 mg p.o.q.d. May consider gradually increasing dose after several weeks by 20 mg per day, not to exceed 80 mg a day. Delayed release capsule. 90 mg p.o.q. week. Resistant depression. Indicated in combination with olanzapine for treatment of resistant depression, MMD, in patients who do not respond to 2 separate trials of different antidepressants of adequate dose and duration in the current dose. Initial, 20 mg fluoxetine plus 5 mg olanzapine p.o.q.h.s. Make dosage adjustments, if indicated, according to efficacy and tolerability within dose ranges of fluoxetine 20 to 50 mg and olanzapine 5 to 20 mg. Depression associated with bipolar disorder. Indicated in combination with olanzapine for treatment of acute depressive episodes associated with bipolar I disorder. Initial, 20 mg fluoxetine plus 5 mg olanzapine p.o.q.h.s. Make dosage adjustments, if indicated, according to efficacy and tolerability within dose ranges of fluoxetine 20 to 50 mg and olanzapine 5 to 12.5 mg. Obsessive compulsive disorder. Indicated for acute and maintenance treatment of obsessions and compulsions in patients with obsessive compulsive disorder, OCD. Initial, 20 mg p.o.q.d. May consider gradually increasing dose after several weeks by 20 mg per day, 20 to 60 mg/day recommended range, not to exceed 80 mg q.d. Delayed release capsule. 90 mg p.o.q. week. Bulimia nervosa. Indicted for acute maintenance treatment of binge eating and vomiting behaviors in patients with moderate to severe bulimia nervosa. Initial or maintenance, may titrate dose to 60 mg p.o.q.d over several days. Panic disorder. Indicated for acute treatment of panic disorder, with or without agoraphobia. Initial, 10 mg p.o.q.d for first week, then 20 mg p.o.q.d. May consider gradually increasing dose after several weeks, not to exceed 60 mg q.d. Doses greater than 60 mg per day not evaluated. Premenstrual dysphoric disorder. Indicated for treatment of premenstrual dysphoric disorder. Continuous administration, 20 mg p.o.q.d initially, may gradually increase dose, not to exceed 80 mg per day, or intermittent administration, 20 mg p.o.q.d starting 14 days before menstruation and through first full menses, repeat each cycle. Off-label uses. Fibromyalgia. Generalized anxiety disorder. Post-traumatic stress disorder. Social anxiety disorder. Safety advice. U.S. FDA Pregnancy Category C. Animal reproduction studies have shown an adverse effect on the fetus, and there are no adequate and well-controlled studies in humans, but potential benefits may warrant use of the drug in pregnant women despite potential risks. That's all the information about fluoxetine we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.